Within the mental health profession, depressive disorders are the most common diagnosis. Depression is commonly categorized as the mood disorder that causes constant sadness, loss of interest and enjoyment in activities once loved, and decreased in energy. Working in the mental health field as social workers, we commonly use the DSM, which is the Diagnostic and Statistical Manual for Disorders, or the ICD, which is the International Classification of Mental and Behavioral Disorders. Going back to the 1980s, the DSM had many definitions of depression. However, fast forward until today, the DSM dives into only two categories: major depressive disorders or dysthymic disorders. Major depressive disorder is identified as having one or more depressive episodes that last at least 2 weeks or loss of interest of once enjoyed activities. Dysthymic disorder is defined as the person experiencing at least 2 years of being sad constantly. 2 to 3 times as many people may have depressive symptoms, but they do not meet the DSM criteria for major depression, thus resulting in undiagnosed depression. The ICD separates depression into mild, moderate, or severe episodes. So if an individual has a diagnosis of severe depression, it can be distinguished by increased agitation or psychomotor impairment, as well as significant somatic symptoms such as headaches, abdominal pain, and pains in the lower backs, joints, and neck.
For this slide, we're going to talk about risk factors and assessment tools for adult depression. Should be noted that risk factors for depression in adulthood are as vast and as varied and as complicated and unique as the individuals they affect. Some risk factors are emotional, psychological, genetic, environmental, metabolic, and biological. In addition, having a family history of depression is a risk factor for adult depression, in addition to traumatic events, chronic illness, substance abuse, and gender, with females exhibiting a greater chance of experiencing depression than their male counterparts. Racial inequities should also be considered as a risk factor. For example, racial inequities could cause economic disparities, which in turn contribute to an increased likelihood of depression. Furthermore, adverse childhood experiences, also known as ACEs, include things such as poverty, abuse, and social isolation. Experiencing any of these things in childhood may contribute to an increased likelihood of depression in adulthood. The more ACEs experienced, the greater likelihood that depression will occur. Many studies have shown that compounding ACEs have compounding effects, with depression being just one of those possible outcomes. In terms of assessments, here is a short list of some common assessments used for assessing depression. One is the Beck Depression Inventory, the Center for Epidemiologic Studies Depression Scales, the Hamilton Depression Rating Scale, the Montgomery-Åsberg Depression Rating Scale, the Beck Hopelessness Scale, the Quick Inventory of Depressive Symptomology Self-Report, and the Standard Health Questionnaires and Screenings. While this list is not exhaustive, it is a list of common assessments. Keep in mind, though, that certain agencies might have their own assessments. However, the above mentioned are considered reliable, and many can be modified to meet the unique needs of the agency. This slide explores the prevalence and statistics of adult depression. According to the World Health Organization, they report that 3.8% of the worldwide population is affected by depression, including 5% among adults and 5.7% among adults older than 60 years old. 300 million people worldwide, regardless of culture, age, gender, religion, race, or economic status, suffer from depression. And in the United States alone, depression affects about 1 in every 10 adults.
In today's treatment for depression in adults, there's typically 2 ways that we go about it. One is through medication. These medications are reuptake blockers. So we look at SSRIs, SNRIs, and NDRIs. So when looking at SSRIs, you would see that the neurotransmitter serotonin as it interacts with neurons in the brain. The SSRI basically the reuptake of serotonin would be blocked, and therefore you would increase serotonin levels in the brain. When looking at SNRIs, we are function. SNRIs work to regulate the chemicals inside of the brain, therefore mood is usually enhanced, and depression is lessened. And then again, with NDRIs, we see the same idea taking place where norepinephrine and dopamine, their transport back into the brain cells that release them is blocked. So with the use of medication to treat depression, we see the idea that neurotransmitters that are associated with mood, happiness, feelings that may be missing during bouts of depression are then chemically balanced with inside the brain to assist in improving mood and feeling. In addition to or in place of medication, we also see many forms of therapies that are performed to help combat with depression. Behavioral therapy is a form of therapy that focuses on activities that once brought the client joy, and then utilizes those activities to then have the client repeat them in hopes that moods and behaviors would improve during their bouts of depression. In addition, the hope here is that through these activities, we will learn new habits that will then bring about success and wholesomeness in the client's life. Another form of therapy would be cognitive therapy. Cognitive therapy focuses on thoughts, so the therapist would try to help the client better understand why they perceive these thoughts the way they do, and then trying to rearrange these perceptions to maybe form a better outcome or another realization of the actual thoughts based on the events that have taken place. When combining both behavioral therapy and cognitive therapy, we come up with behavioral cognitive therapy, CBT. CBT works thinking that if we change our thoughts and we change our actions, then hopefully together we'll start to see improvements overall. So as one area improves, the others will improve, and then the others will improve. So therefore, our mood, our state, our mind, everything is going to then be changed and shifted, and the depression would decrease. The positives with CBT are that, for one, it's short term. Two, it's evidence-based. So as we are working through sessions, we can start to see the actual change or evidence of the therapy working.
There continues to be lack of overall knowledge, despite depression being one of the most prevalent mental health illnesses and major causes of disability globally. Such lack of knowledge can foster stigmas and misunderstandings, which can lead to prejudices and marginalization. According to research, additional barriers include lack of physical and financial resources, lack of transportation, lack of access to treatment, and scarcity of services in the United States, all of which can contribute to individuals not getting the services they need. Social workers play a vital role in advocating for depression as a public health issue, in addition to problem solving and providing assessment, diagnoses, therapy, case management, and a range of other services and interventions. Without the implementation of services and interventions to prevent and greatly decrease such barriers, those struggling with depression and depressive symptoms will continue to experience symptoms of their mental illness that affect their body, mood, and thoughts. Untreated depression not only increases the chance of participation in risky behaviors such as drug or alcohol addiction, but it can also ruin relationships, elicit rejection from others, lead to more serious illnesses, and lead to termination or decreased workplace productivity. Without addressing such barriers, the critical role that social workers have in improving the overall well-being and mental health in our society will be at risk and greatly challenged.
In conclusion, depression is experienced globally. It doesn't discriminate. And as social workers, it is now our job to advocate, bring awareness. In doing so, we need to be mindful of depression. We need to understand it. We need to be able to spot it or understand it when it's verbally spoken about. Also, it's our duty to kind of break the stigma that for so long has kind of covered up depression and just swept it under the rug. This is something that loved ones, people around us, silently struggle with in our community. And it's now our duty to advocate and help protect and serve those around us and bring them a glimmer of joy and understanding that they're not alone, and that it is a very common diagnosis that can be cured, and there is hope.